In Australia, we have a very clear principle, and it's enshrined in the regulations around private health insurance. Doctors determine treatment. I don't know that any insurer is trying to stop doctors being the key driver of clinical treatment in this country. I think it's right that doctors drive a lot of cost, and often they don't practice the way they should practice as in their own medical evidence and literature. So I think it's reasonable for particularly the public and for government and for any organisation to question whether they are actually providing good quality effective medicine all the time. I think they should be held to their own standards. I think Michael Gannon's he's putting his head in the sand. I mean, every profession, every service in the 21st century has to account to consumers. I think the idea that doctors should have their fees transparent and people will be able to make comments about whether they're getting good service, what the facilities are like, whether they're waiting too long, that's completely what you'd expect. We're being really clear at the moment not to argue that clinical outcomes should be in a public website. I think that's a much trickier thing. And I think both Medibank and Bupa have been working behind the scenes with the Royal Australasian College of Surgeons, where they can give feedback to their members on perhaps unreasonable variation. But I think Michael Gannon and the AMA need to get real. Consumers will give feedback. They're giving feedback now in a completely unmoderated fashion, so it's time to listen to the feedback, not try and pretend that you're immune from it. I'm not sure that we've ever said doctors' out-of-pockets are the cause of premium increases. Clearly they're not, because they're not part of the claim process. I think the important thing is doctors' fees themselves are a relatively small portion of the whole. If you take a hip operation, say, if you include rehab, we might pay $30,000 to $65,000, of which the doctor's fee is actually relatively a small part. It might only be $5,000. So, the doctor's fees in general, mostly they accept the payments that insurers give them. Some charge much higher than that. So, Michael Gannon's right in that respect. But doctors drive the treatments, and I think where we question it is, why would we do treatments that are perhaps not great value? Things like spinal fusion, if you look at the medical literature, probably only 10–20% at most have any real benefit. And yet we see lots of doctors doing these things, which it's hard to argue they're a good medical practice. Well, I think Michael Gannon gives some industry figures that say 88% of all medical specialist interactions are gap-free, and about another 6% have costs of up to $500. That's absolutely true. I think, but those are the overall figures. They include all of the smaller operations like gastroscopy, colonoscopy. They include anaesthetist fees, and they're actually remarkably good at not charging big payments. Assistant surgeons. So if you actually look below the general figures, if you want to look at the surgical fee for a cataract, for a hip operation, for a removal of prostate, what we're finding is that between 20 and 40% of the surgeon's fees in those specific operations are over $500, in some cases over $5,000. And I think so that there is almost like a dinner table talk. Well, I went to my doctor and he suddenly gave me this huge out-of-pocket fee. And so you can see that a minority, but a significant minority of surgical fees for some of the common operations are quite expensive, in the many thousands of dollars. So yes, Michael Gannon's right, but if you look below the detail, that's why we get these war stories. I agree with Michael Gannon's comment that doctors have done a lot to protect access to the health system, whether public or private. And in fact, I agree strongly that, I don't believe insurers, and I certainly don't believe the bureaucrats in Canberra or anywhere else should be determining access to care. I think very much the onus is on doctors to do that, but doctors then have to take that responsibility. And I totally agree that insurers should work with the medical profession to figure out ways to ensure that there's access to effective care and that the kinds of rationing that we're prepared to accept as a society are kept to a level we can cope with. I think totally. The doctors are a key part of the system. No one wants to take away that part of the system, and I think we'd be delighted if we had the opportunity to work constructively and collaboratively with the medical profession in doing that. you know, a system like ours in Australia, I mean, the outcomes are remarkably good. You know, life expectancy is in the top 3 in the world. I think if I stood back from the system, I would say the bit of the system that needs the most support is primary care. We have a very difficult funding model for primary care. We don't value general practice and primary care as much as we should. We should have a system where specialists help GPs to be the cornerstone of the system, and it seems to me that, you know, whatever our belief about our role in the system, the more we improve primary care, the way we fund and support it, because that's where most people get their primary advice. You know, the more we can do around prevention, that's what we should be aiming for. We've got to make sure that healthcare is effective, that it's value for money, that we're not wasting money. And I think that's the challenge for all of us, and it's not just health insurers. It's the challenge for doctors, it's the challenge for hospitals. The consumer pays for everything at the end of the day, and so we've got to treat it like it's our own money. There's a big lobby at the moment to think about what you would have in every health insurance policy. Some people have argued for inpatient mental health access, and others have argued for, you know, maternity and associated care around birth. They would be very attractive, I think, for most people. The problem is they add a lot to the cost, and we know that for the, you know, the budget or basic end of hospital policies, if you added those two things into every policy, they would add, I suspect, in excess of 50% to the price. We know because they're in policies that are higher up. There's just no cheap way to add some of those really important services. I don't think there's any obvious solution. You know, the inpatient admission, the average cost is about $9,000 or $10,000. The average cost for maternity, you know, particularly if you have a caesarean, and in private now 48% of all births have caesareans, is very expensive, into the 5 figures. I don't think there's any easy answer. If you want really good quality care in some of these really complex situations, there's no cheap way to provide that good quality care, and I think we just have to decide what we can pay for as a society, really. Health insurers are accused at the moment of spruiking cheap health insurance products, the so-called junk products. I mean, we're getting so many consumers who have affordability as a really big issue, and they're saying, well, we just can't afford some of your policies. You know, tell us what we can get for whatever amount that we can afford. And we know very personally in Bupa, because we don't have a lot of the lower end. And so I would say we're responding to consumers. It's a pity, because some of these products don't have enough in, we feel. But what do you say to someone who can't afford anything more? I think if you look at the 37 or so health insurers, only 2 are listed companies, Medibank and NIB. There's a small number, very small, that are associated, like with the Commonwealth Bank and with one of the general insurers. All the rest are mutuals, or in Bupa's case, a provident fund. We don't have shareholders. We might be called for profit. That's only because we can then use any money we make into other areas, like in our case, aged care. So the net operating margin for Bupa, and I've looked at it over the last 8 years, has consistently been between 6 and 7 cents in the dollar. In other words, that's the money that we would make before tax, because we pay tax. That's the net operating. It hasn't changed pretty much in 7 years. So, you know, certainly on behalf of Bupa's sake, we're not trying to make more money out of the system. The only way we've grown our profit is by having more members.